Now, more than 900 people have recovered from COVID-19 in South Africa, while the number of people who've died of coronavirus has risen to 50. Health Minister Zweli Mkhize says the number of recoveries is encouraging. The department is urging people to continue following precautionary measures, though. For more on this, I'm now joined by Angelique Coetzee from the South African Medical Association. Angelique, good morning. Thank you so much for joining us. First up, before we talk about the recoveries, there have been a lot of concerns, obviously, about the growing number of frontline workers contracting COVID-19, especially in the private sector. This is due to a lack of PPE. Are you concerned about this? Is the situation getting any better at all?
Yes, good morning. Good morning to all the listeners and viewers out there. Yes, SAMA is concerned about the lack of PPE, although that is now being addressed greatly by the Business for South Africa group and all the donations. But, you know, the cases that we are seeing now, as what Prof. Slim Karim tried to explain quite a few times, has most likely been infected between 1 to 3 weeks, with an average of 2 weeks ago, where we still had a lot of problems with PPE. Also, if you remember very well, that the first curve was more likely or had happened in the private sector, with those patients that came back from Italy and from overseas. So that means most of those patients got medical schemes, and they then had access to the private facilities. Again, during that time, there was not a good PPE or good social distancing. We have been promoting that very heavily the last 2 weeks, so that people please do if you go to shops, do the social distancing thing, the masks. You know, if you look at the data that came in from most of the first world countries, they protected all the doctors in the ICUs and in the wards. But I think one of the reasons why they had such a high incidence under the healthcare personnel is because they didn't paid a lot of attention to the first line of doctors and nurses that first see these patients. So for me and for SAMA, those first contact in the hospitals or at the casualties, there you must make sure that those personnel really need to wear a mask, gloves. And for me, as 30 years in private practice, I would say you need to have a gown.
Yeah.
Because you are touching those patients, and you need to start looking at shoe covers as well. Yeah. Although there is not clear enough data, but you need to double check that you do not step onto the virus if you cough and then you walk around in the hospital.
That's very true. Angelique, sorry, talking about data there, we heard your concerns on that particular question. You're talking about data, though. Over 372,000 people worldwide have recovered. We're talking about over 900 people in South Africa. Are we learning anything at all from these recoveries that might be able to assist us when it comes to fighting this pandemic?
We are really still in a learning curve. So the first thing that we see with a lot of these patients that recover is actually in line with what the international data is, that they had not been affected that badly. They could have, most of them could have self-isolated at home. It's mild symptoms, although remember, if we say mild symptoms, the patient experiences it as a real symptom, but it's still mild symptoms. And you, by, again, your vitamins, your vitamin C, your zinc, your good multivitamin, use your cough mixture, use painkiller or whatever for your body aches and pains, stay at home, stay in your own room, don't go to other people. That still stays. And those patients actually recovered quite well. It's another case in the hospitals, because remember, we expect that there shall be people dying, and we have said that right from the beginning. Unfortunately, it's the same. We've learned the same thing from the other countries in our countries, with the ones that is in ICU. Some of them recovered. It depends on your your immune system and how well your blood pressure is controlled, how well your sugar is controlled, how well you look after yourself.
Angelique, I must ask you about, this is one question that everybody's, we're all, so many rumors going around about this. Can you just clarify something for us? Does recovery mean immunity? Will you be immune once you recover?
For now, at this stage where we are, it means that you will have immune resistance. Your body will, if the body has been infected again with the same virus, it will immediately recognize that virus and send the antibodies that you made when you first got the virus to go and attack. I'm now trying to make it very easy for the public out there to understand. So far, that is what we say. But you know, we're still going to be in this for the next 4, 5, 6 months. Time will learn whether we are wrong today or not. And but that is where it is currently.
Okay, fantastic.
So if you survive, you had it, you're supposed to have immune or resistance against this virus. But that might change as we start to understand this virus much better. But for now, you're safe.